Hello, everyone, and welcome to the Modern Philosophy Podcast. I am your host, Ashlee Haze, and I am so excited. I say that every episode because I'm always excited because I bring on guests that I want to hear from. But today is very special because if you've been following me, you know that I started a media production company called Philosophy Media Group. Well, our first major contract was actually with Black Health, a nonprofit organization based right here in Atlanta, Georgia. We've been producing the Black Health podcast for over a year now. We've been rocking together. But this is our first crossover episode. So this is going to be a Black Health, Modern Philosophy crossover. The whole gang's here. First of all, I'm going to tell you about Black Health, and then I'm going to let everybody introduce themselves. Black Health is an Atlanta-based nonprofit organization founded by 4 graduates from Emory University's Rollins School of Public Health: Khadijah Amin, Matthew McCurdy, Marcilla Ryan Harris, and Paula Wheeler. As students in a predominantly white institution, they quickly noticed gaps in the understanding of the complexities of race and health from both peers and instructors. They quickly realized that lack of accessible and accurate information around the intersections of racism, race, and health was not unique at that particular academic institution. This information is missing in most spaces and, most importantly, in our communities. So they decided to do something about it. So without further ado, let them introduce themselves. Y'all welcome Black Health. Thank y'all for coming.
Thanks for having us, Ashlee. We're happy to be here. That's so cool. I didn't know we were like your first major contract for Philosophy Media Group. That's awesome.
It is awesome. I appreciate y'all. So who wants to go first?
Paula, you can go first.
Okay. I'm Paula Wheeler, one of the co-founders of Black Health. I'm also the director of programs. I have a lot of experience in HIV/AIDS work, also global health. I have managed programs in South Africa, Nigeria, Kenya, Cambodia. So that's my passions with Black Health, is to really expand our reach across the African Black diaspora and just really, continue to make those connections and build power across communities all over the world.
For sure.
Awesome. Hi. My name is Khadijah. I am the Director of Policy and Research at Black Health, based out of Atlanta, Georgia presently. My background is in health policy, social policy, and healthcare access for multi-marginalized communities. And yeah, I'm trying to think of what else I do. I'm in a PhD program right now.
Can't imagine. Well, thank you for being here, Khadijah. Lamborghini Mercy.
Hey. Yes, hello. My name is Mercy. Everyone calls me Mercy. Short for Marcilla, but Mercy sticks with people. So, born and raised here in Atlanta, Georgia. One of the few left here originators. Have a background in health policy and management. I've done a lot of different public health program management for academic institutions and state federal programs. Within Black Health, I'm the director of equity engagement. I'm also the person who loves to keep us organized and creating tables and charts for any and everything you can think of.
Well, thank you, Mercy. We always need an organizer in the group.
Yes.
And Matt.
What's going on? Hey,
What's
Ashlee.
going on, darling?
I'm Matthew McCurdy, co-founder of Black Health. Honestly, not sure what my title is. I kind of forget.
You say president.
Co-founder, president of the
president,
board.
CEO.
We'll have whatever. My background is actually in political science and sociology. I didn't start in health, but I got really interested in how our structures, our systems impact health outcomes, especially for Black people. And so Black Health really works as a mechanism for us to do good work in Black communities and really target those structures that are leading us to die sooner and get sicker. So looking forward to talking more with you today, Ashlee.
I'm really excited about it. We're going to have a good time. Mm-hmm. All right. So now that we've done our proper introductions, I have a little icebreaker for us. I'm trying to make things a little more fun around here. So my question for y'all, and I'm going to answer as well, is What do you miss most about old Atlanta? And what are you loving or learning to love about new Atlanta?
I think Mercy or Matthew should start as our OG Atlanta residents.
I can start.
Okay.
So, I think a few years ago I had this thought about like, will there be no more Atlanta accent? And I don't have a very strong Atlanta accent, but once you're in Atlanta, you know the Atlanta accent, you hear it. And I miss going to places. And it's almost a mumble. There's a little like country southern twang to it.
Yeah.
Yeah, like we could speak like that and go out in public. And I miss being able to go places and mumble something under my breath and everybody knows what I said just because they know. And so I feel like as more and more people start to come to the city, that experience is going to be less and less. But when you meet somebody that's from Atlanta, my accent changes. It happens naturally.
Yeah.
For sure. What I do like about New Atlanta is I think we have a lot of really good food here now, and I could say like 10, 15 years ago, I didn't have any money either. But,
fair.
But like, there's a lot of really good restaurants and new restaurants popping up, and a lot of really good chefs. So I'm hoping that we can keep that unique aspect of Atlanta, and it doesn't become like overly like chain restaurants that exist everywhere. I think there are a lot of really good chefs here, so I'm enjoying the food scene here in Atlanta.
Yeah, that's one of the things I was gonna say. All right, Mercy, what you got?
I guess really kind of similar to Matthew. Like, thing I miss about old Atlanta, I just kind of miss like just that Atlanta culture. Like, it just felt different in the city. Like, see, now you're gonna make my accent come out. But now it's like the city was just different. Like, you could just go to like the park and kick it, hang out. Like, anything could turn into something just because it was just such like community and like camaraderie with everyone, and like it just felt like home. Like, and so now like I find like a lot of those communities and those pockets are like slowly starting to disappear. Like, I grew up on the south side, but all of my family was like on southwest Atlanta, the west side. So like seeing how all of those areas are changing, and it's like all of like the mom and pop stores that have been there for 40, 50 years are gone, and like the restaurants and just those staples in the community is changing. So that makes me sad. But on the other side of that, with New Atlanta, I love how they're developing the city. Like, putting stuff in here that like, oh dang, I never thought Atlanta could have some stuff like this, because Atlanta was never built to be a major city in the first place. So just seeing it grow like that is like really fascinating. But I'm just hoping that we can still hold on to the Atlanta culture, like what made Atlanta so special.
For sure. Khadijah, what you got?
Yeah. So I've not been here all my life. I've been here all my adulthood though.
Okay.
So I feel like I wasn't born here, but I was raised as an adult. Raised
I feel that.
Raised myself.
Raised myself here.
That growth.
And yeah, I mean, even since I've been here, like this past like decade plus, echoing what Mercy and Matthew said in terms of like these developers and like the unique factor of Atlanta, and really all major cities it's like going away. Like all the major cities in the US are starting to look alike, and I don't like that at all. What I do like is just like how diverse it is in Atlanta. Like, I think a lot of people think Atlanta is just like black or like black and white. But there's like pockets of like every culture. There are Black folks across the diaspora here.
Sure.
So I really love that. Yeah, I love the food.
All good things to love. Paula, what you got?
Wait, hold on. I forgot the other. Actually, what I was going to say, but I totally forgot. I just like how queer it is here. Like, just the Black queer scene is so vibrant, and something that even like in other like huge cities, like you don't get that. Like, there may be like a gay community, but it's real Caucasian.
For sure.
Real cis male. So I really appreciate just the Black queer community here.
Agreed.
Like Khadijah, I'm also not born in Atlanta. I'm from Detroit, so I'm not ashamed of where I'm from. I rep it hard.
I mean,
as well.
and Atlanta got some ties.
Exactly, a lot of ties. And my Detroit accent also comes out when I start speaking to someone who's from where I'm from as well. So I get that. But I moved here in 2014 to go to grad school where I met all of them. And at that time, I remember like department store was like popping. Like I remember being in line outside of department store and that being such a like formative experience for me in Atlanta. Like this is the best fucking party I've ever been to. Like, oh my God. So I think for me too, it was a particular time in life too.
Yeah.
Like I was in my mid 20s and stuff. So it was just like, oh, I'm an adult. My brain is fully formed and I'm having a great time. And like
fuck it up with alcohol.
Right. But like
cheap
department
alcohol.
store, like the Edgewood vibe, that time of Edgewood was so cool. And so like just meeting all of y'all and like forming like these really, really amazing friendships with like other Black people. That's what I miss. I don't feel that same vibe like in Atlanta, especially because a lot of those places have closed down. Like department store closed down, L Bar closed down. So there's just some things that I just like really used to do that I looked forward to being able to do for a long time that I can no longer do in the city. And what I like about it now, this is so stupid. I know like what I like now, what all of y'all said, the development and everything is really great. The Beltline, awesome that they're building that up more and more. But I was like going places and I was seeing like dogs everywhere, and I'm such an animal person. So I was like, okay, actually, I kind of like this, white people. Yeah, like let's bring our dogs everywhere. Like, dogs can go everywhere now. I know that is like the one, like that's my white gene coming through. Like, 'cause I do love having a dog around.
I feel that.
Yeah, I think it's cute. But that is definitely a sign of gentrification.
For sure. Let's see. So I'm originally from Chicago, but I moved here right before my 10th birthday. So I'm from the East Side, but I'm also from Chicago. So it depends on who I'm talking to and the instance. But I think what I miss about old Atlanta is the rent prices, first of all. But I also miss like the open mic communities, like Jasmine's when we were at Morehouse and, Georgia State. Like I miss Java Monkey, the old Apache, which was, yeah. And so I miss sort of those niche artistic communities. Like you knew where to go in Little 5 Points. You knew where to go in Decatur or Midtown to just have a good time and have a real underground time. And I feel like everything's so commodified. A lot of the places are, closing or move locations where it's not as accessible. And that makes it tough. But what I like about the new Atlanta is the art. But I really like the infrastructure it takes to art, like the Beltline, the murals, the fact that I can frequently see Black art happening, going up, that it's new, that it's fresh. And I think even just the newer artists to the community, like the ones who are coming from LA and New York, I do think that their contributions to Atlanta culture have been dope to see. So that's kind of like my take on the old and new Atlanta. But let's get down to business. We are here to talk about Black health. We've done nutrition, we've done finance. And so this is our first real intimate talk about health and issues that affect us. And so one of the things that y'all have activated me in regards to is sexual health. So I participated in your HIV event or workshop last year in relation to women. And that was my first time, hearing that Black women should or could consider PrEP. Like I'd always heard it in like relation to gay communities, LGBTQIA communities. And I also wasn't aware of the rising numbers. And so that kind of it sent me into panic mode, one. But I also it activated me to be more. And I've always been the type of person, like twice a year, I go get my STD panel. I try to get a physical once a year. Like I've just been the type to do that. But now it pushes me to ask more. To ask, hey, when is the last time have you ever gotten tested for, HIV? What was your last test? Opening those conversations. And so I want you all to talk to me a little bit about what are the numbers? Why are we seeing such an increase? What exactly is PEP and PrEP? And talk to me about the accessibility of those sorts of things.
Yeah. So Black women are 15% of all women, like the female population in the U.S., but we make up 60% of new HIV diagnoses out of women. So this is on women only, not all HIV diagnoses. But so men still have higher rates of HIV than women, but just looking at women, Black women are 60% of the new diagnoses for HIV. So obviously, like, very disproportionate.
Absolutely.
And the burden of HIV in women is definitely, like, that burden is really hitting Black women the hardest. And some of the kind of like reasons for that, like one major like risk factor for Black women is being involved in the criminal justice system. And that is within like being incarcerated, currently or formerly incarcerated in a prison or jail, but then also like those like community like services, like community corrections services that are external to actual like jails and prisons. So like parole, probation, just being involved, interacting with the criminal justice system is connected to a higher risk of HIV for Black women. So just kind of thinking about like bigger issues, like obviously that goes back to like the whole issue of mass incarceration, which is a huge, that's something Black Health we teach about as being like one of the premier racist policies and practices. So when we talk about systemic racism affecting people's health, we often use the example of mass incarceration, and just the idea of Black people as being criminals, being bad citizens, and so they need to be controlled, which we also know is a output of like slavery, you know, and just like criminalization and, you know, our whole entire history. So modern day, you know, watch 13th, you know, that's what mass incarceration is related to. So that whole racist system is having a disparate impact on Black women's HIV and other STI rates as well.
That makes sense.
Yeah. And those numbers, I'm pretty sure they're specific to Black cis women. So when you look at the disparities in HIV outcomes for Black trans women, those are also incredibly high.
Yeah, that makes sense.
Yeah. And so I know you kind of touched on it earlier, but like with PrEP. So PrEP is pre-exposure prophylaxis, which is a pill and now an injectable. So you can take either or, whichever works for your lifestyle. It's a pill you can take once a day or an injection that you can get every 2 months that is 99% effective at preventing HIV. And so a lot of times when you see PrEP marketed, it is marketed to LGBT communities, specifically white, gay males. And even in some of the clinical trials with testing the drug, like Black women were completely excluded from those trials. So it's like, okay, but Black women, obviously, if we're making up 60% of new diagnoses, we should be being told about PrEP and looking at, hey, like, are you in having sex? Like, how do you feel about your risk? I hate that word, but you know, coming in contact with HIV exposure. So, and then PEP is something post-exposure prophylaxis, like if you're ever in a situation where you believe you may have been exposed to HIV, you can go to the doctor, they give you medication. They say the earlier the better, so try to get it within 72 hours of exposure that you can take after you think you've been exposed to prevent you still from contracting HIV. So it's like there are all these options that people just don't know are available, especially again within Black communities and with Black women. Even when we look at Black men who sleep with men, Black women, like we are the lowest uptake of PrEP usage. But again, are at the top of like every list for new HIV cases. So it's like we need to spread the word, get people to know about it so they can talk to their doctors about it and, you know, have those conversations. Because even doctors aren't, you know, necessarily starting those conversations.
They're not volunteering it
at
like,
all.
I have to go and be like, hey, I heard about PrEP. Can you let's talk about this.
Right. Because even when I go get like an HIV test, like, you know, I think as soon as someone asks for an HIV test, someone then should follow up, say, hey, have you thought about PrEP? Like, do you know about PrEP? But it's like, I go get an HIV test. They just say, okay. There's no follow-up.
No further conversation about it.
Yeah, and what we see a lot of is, you know, this aligns with just healthcare access in general, right? We know that our Black communities they don't have healthcare access in their communities, but also when they go to access them, like you said, they're not getting the proper triage services and offered the proper services once they get there. And that's especially true for women because of racism, because of misogyny. They're not even considering that they may be at risk, right? And so you have a lot of people who aren't a lot of physicians, a lot of nurses, people in the allied health professions who are just not properly assessing the word that Mercy hates risk. But given the numbers, right, again, we want to think about the protocols that people should be following. Given the numbers, people who are coming in the clinic, they should be saying, hey, are you on PrEP? Would you like to know more about PrEP
Right.
or PEP? And then be given the opportunity to say yes.
Absolutely. Absolutely. So, how do we get people, especially, most of my experiences are with heterosexual Black men, and I encounter a lot of people who are like, I'm not going to no doctor. I don't do clinics. I don't do that kind of stuff. This fear of testing, but also a fear of testing that exists alongside an avoidance of condom use. How do we get people to overcome that fear?
One, I think I know so many. One, I think we have to just normalize the conversation.
For sure.
I know, like, in a lot of my sexual experiences, I'm always the one to initiate that conversation. And a lot of times I've had men get offended by me asking when their last HIV or STI screening was. Other people are like, dang, I never thought about it. And so, like, a lot of times it's just something that, like, oh, I guess we should have these conversations. Like, we want to have sex, but we don't want to talk about
Don't want to
sex.
talk about, and don't want to talk about the impact of it.
Right. Exactly. So I think, one, just in our own personal relationships, we just have to start normalizing those types of conversations. You can tell me all these nasty things you want to do to me.
Period.
Like, no problem. You don't even know me that well, but you got all this long list. But the moment I say, oh, okay, cool, what about an HIV test? Then it's like, why are you asking me about that?
You got something to hide,
right?
Boy, what?
It's like, I wouldn't be asking you if So I think, like, definitely starting those conversations and just kind of normalizing it, like trying to remove that internal stigma that we have, like, surrounding that type of stuff.
Absolutely.
I think all like Black people really need to know that HIV is no longer a death sentence. Like, I think that I've been saying this for years. Like, we all, like, a lot of us, in the field have been saying it for years, but it still seems like it's not reaching like the populations who really need to hear that the most. And I think that's why you get a lot of other reasons, but there's also that's a strain of like what causes like some of the nervousness in men.
I see.
They're
It's
scared.
like, if I have it, then now I have to deal with that.
And that's a lot of people in general too. Like, they are just scared to get those results because they feel like there's stigma. They feel like, oh, that means I'm dirty, and people say that they're like, yeah, I just took an HIV test. I'm clean,
Right.
to say that they were negative. So there's a lot of like stigma in our language and everything and how we even talk about HIV. And a lot of that is very much related to obviously it being a sexually transmitted disease. So people have a big thing around sex. And then like just what we had learned about HIV like in the 80s and 90s, which just totally, it was like such a scare campaign and people had no like recourse. It was a death sentence basically. And so then what some people also know is like, okay, there's a treatment, but then you're going to be taking all types of pills for the rest of your life, your short life probably. And it's like, no, actually now the treatment is really simple. Like, it's like one pill a day for most people. Like the vast majority of people, only with HIV only take one pill a day. And they are actually seeing that people who have HIV who stay and remain on treatment kind of live longer lives than the average person because now they're actually regularly engaged with the healthcare system, get checked, get access to healthcare. A lot of times, they're living a bit healthier lives because you kind of do, it's best to do that. It is still a serious disease. So
sure.
still eating healthy, exercising, things like that become that much more important. And so you see people kind of more motivated to do those things. And the medication just works really well. And like the side effects really are not that deep. I've heard physicians say that they would rather have HIV than diabetes, just as far as like with the management and what to expect. Like a disease like diabetes can be even more like all over the place and a risk for, a bad outcome than HIV, because where the science. So effectively, we have a cure for HIV in our science. Like if you take that medication, every day, you can become very quickly. Actually, a lot of times people go like what,
within
a
like
few
a week.
months.
Undetectable.
A week.
I've seen,
Okay.
I've seen results quickly as in a week. Like one patient we came in contact with at one point in time, like came in, got tested, their viral load was through the roof. Like HIV was going crazy. Like they were almost, their T cell count was really low. Like they were almost like clinically with advanced stage HIV, which is known as AIDS, but again, trying to change the language around how we talk about this. So you think of it more as advanced stage HIV, which is when your T cell count is below like 200. So the student was very close to advanced stage HIV. Within like a week of being on antiretrovirals, they were almost undetectable.
Wow.
Like, so the medication works quickly. And like when we say undetectable, that means like there is no virus detected in your blood level. So then you cannot transmit the virus to other people.
Yeah, and I think that's a really important point. I was a sexual health educator for like a year and a half with Planned Parenthood. And one, just getting people the information on viral diseases versus bacterial diseases, and like what can be cured, what needs to be treated. That's really important. So your bacterial diseases are the ones that you can get treatment for; they'll go away. Your viruses are ones that you may have to turn treatment on for long term. I think secondly, what I really learned in doing health education, sexual health education, is that a lot of het cis men and boys, even at the time, don't see sex as like a relationship or a partnership activity, and that they have a responsibility to their partner to be clean, and to like get tested. And so they think of it as an individual trait, right? Like I don't need to get tested because like I'm good, I feel good, and not necessarily that I want to make sure that my partner is good, the person I'm having sex with is good, and that we can sort of. And I think that goes back to a whole host of problems with our society. And then, something that we also teach, not only, the young boys and sexual health, but also the young women is, condom negotiation, right? Giving them the skills, the vocabulary to say, actually, no, we need to use a condom because it's going to protect us from not only pregnancy, but diseases and all of that, and knowing when to stay away. I think we often allow people to explore, put people in unsafe situations where they don't feel like they have the ability to negotiate.
Yeah, there's a power dynamic.
And it's a power dynamic, right? So certainly, there's an aggressive stance there. There's, they're trying to, and also you're trying to get pleasure, right? This is a moment where it's like I'm trying to have some sex, but like giving people that skill set and the ability to say, hey, this is why this is important, or feeling comfortable with walking away if they can in that moment when someone denies using a protection, I think is really important.
Yeah. Go ahead. I was just gonna kind of echo that, and I know we brought up like stigma, and we talk a lot about stigma like at the individual level that like individual Black folks may have, but I think it's also important to frame stigma as like a structural issue, something that's ingrained in culture and media. Like I remember growing up, and Paul, you kind of touched on this, like the role that like the like media as an institution like played in really stigmatizing HIV diagnoses, especially like, oh my God, there was like a whole I feel like it was a whole campaign that was like very like homophobic.
Oh, for sure.
And very the down low man that want to like.
That was Oprah fault.
Yeah, that could be a whole other podcast.
Oprah, but that's a
gonna
mess.
be a whole nother episode.
So across like media, across health systems, there are so many things that like healthcare providers do, that healthcare institutions do to further stigmatize HIV across like political decisions. And like, we're based in Georgia, we're based in the South, in a conservative state. And like, these politicians are actively going after HIV
For sure.
treatment and access. And so that's something else, like Black Health, we're really big on, not just focusing on like individual behaviors and what we can do to protect ourselves and protect our health, but also really thinking about where can we address these issues at the structural level.
For sure. And Mercy, you had something?
Oh, yeah. Just to go back to condoms, I know, and even to Khadijah's point about like the healthcare system overall and how providers talk about things. So like on the provider side, there can also be like a lot of judgment from providers and like bias. Like, so even when someone does go to the doctor and they're talking about their sexual preferences and their behaviors, they can be shamed by the doctor. So, because there are people who just don't like condoms.
Yeah.
And so it's like you can tell someone to use a condom, but if they don't like condoms, they're just not going to use them. So instead of like shaming them for not wanting to use condoms or just, basically just saying, use a condom, use a condom, use a condom, and they tell you they're not, find other ways. Like, okay, so you don't want to use condoms. Can we get you routinely tested every 3 months? You're getting a test. You don't want to come into a clinic. Hey, did you know you can get a HIV test and take it at home and get your results at home in 20 minutes? Like, if that's a barrier for you, come into a clinic. Or, okay, you don't like to use condoms. Can we reduce the number of sex partners that you have then? Instead of having 5, let's go down to 2. Maybe you just have one partner you don't use a condom with and you use condoms with other partners. Like, trying to find ways to meet people where they're at, because people just not going to do something. Like, we all know we all have things that we know we should do that we don't do. People don't always wear seatbelts, but
that's fair.
So just finding other ways to engage people and taking charge of their sexual health.
That also adds an element of grace, which historically hasn't been present for us at all in medical practice and ethics. It's like this sort of grace for like, okay, there are other options. Let me educate you on all of these options instead of, just zeroing into one, which I love. You don't want to use a condom? Fine. However, I'm gonna need your paperwork.
Right.
Matter of fact, we're gonna go together.
Yeah. Make it a little date night.
And you can do it at home. So you can just like with your partner, like let's just do a rapid test here, like in the comfort of our home, share our results together. Like that can be like a intimacy building activity.
Yeah, absolutely. It builds trust.
Exactly.
And I like just like what you were saying, kind of Mercy, like a lot of people, like the way that they think about diseases and risk is like kind of incorrect or not like showing like the full picture. So people can be real black and white about it. Like people think like, if I have sex with someone who has HIV, I'm gonna get HIV immediately. Actually, like your kind of like risk of getting HIV from one sexual encounter, even with someone who is positive, actually pretty low. And so really what we're seeing with like high HIV rates are like, there's a lot of the virus kind of in the community. There's people in your sexual networks who have HIV and you're encountering these people and that's what's having it spread, And so just kind of talking about risk reduction, right? So like if you are kind of like aware of who's in your sexual networks, you are testing yourself, you are having your partners to be tested. We're spreading out that like information about like, okay, maybe I might not be your only partner. So can you please like take some at-home tests home and test your other people that you might have coming through. And then also if somebody in your network is, like someone you are dealing with is HIV positive, like let's not stigmatize that person and shun them and actually get them on treatment, because now if we have someone in our network who has HIV, but they're undetectable, we all in the same boat. We're cool. Like, like if they remain undetectable, that person is now safe. Like the rest of us is to have sex on HIV lines, So it's like, kind of like there's a lot that can be done, especially now. And so just thinking about it more holistically, like we've been saying, is better than being like, use a condom, don't use a condom. I'm not going to have sex with nobody who has HIV, you know, like being super scared. Like you can have sex with someone who has HIV. Like you just want to help that person be undetectable and make sure that they are undetectable. And that really helps from like, you know, one of the best ways for a person to remain on treatment is having a strong community and support.
Yes. Yeah. That's good to know. That's good to know. And I actually have a story to tell because I was so inspired. I went looking for resources. So at the time, I didn't have my health insurance had lapsed, which happens sometimes. We've talked about that. And we will talk about that more as an independent artist. But I was like, I want to go get a test. So I went to Black Health. I went to your website and I looked at the resources and I found 8 Atlanta and they do testing 5 days a week. And the earlier you go, they open at 10 a.m. If you're there at like 9:45, 9:30 a.m., you can get in early. And if you tell them that you want a conversation about PrEP or that you want PrEP, they'll fast track you.
Oh, wow.
Like a fast track now.
They'll fast track you. Yep. And I went and I wanted to do it so one, I could tell y'all this, but also, you know, so that's the process, right? Like you look up a place, you go. They're going to ask you about insurance. I didn't have to pay anything for the visit, but I did make a donation. I didn't have to pay anything for PrEP. They have the paperwork there. You can sign up. You can get it. At the time, they didn't have the shot, but I'm going to go back and say, hey, are y'all doing the shot now? And so, you know, and just so that y'all know, once you go for a test, there's 2 parts. There is a blood test. So they're going to, you know, take some blood out of your arm. Stop acting scared, okay?
Right.
You can, and fear of needles is fine, however, but I have a bunch of tattoos. I was like, surely, you know, it's fine. And also I have to think about the greater risk, right? If I don't let them do this, then I'm not getting a full picture of my house. So go, you know, calm your nerves if you need to. Take some chamomile tea, take somebody to hold your hand, but get it over with. It takes about 5 minutes and really it's just a pinch. And they're going to, you know, take it. And then you're going to do a urine test and put some pee in a cup. And that's it. And you're going to wait for your results. And some of those results come back in less than 24 hours. Yeah. Most of them come back in a week. And you're going to know. And then you go and do it again in 6 months or 3 months or whatever you and your provider talk about. And that is how you go get tested for STDs and STIs. And I highly recommend it. I love 8 Atlanta. Y'all can support them. But you can also search for other resources. You can also talk to your primary care physicians. And there you have it. That is how easy it was for me to find the information thanks to Black Health. So thank y'all for being I waited to tell y'all that.
I love that.
I did. I was like, you know, I produced this. I should know. So y'all make sure that y'all check out. What's the website?
Black Health, BLK HLTH.com.
Blackhealth.com and check out their resources. So I'm curious, what other health issues are pressing for y'all? What are y'all passionate about? What's been coming up lately? What should we know?
Yeah. So we just recorded a podcast on cancer.
Oh yeah, y'all did. I wonder who produced that.
I know her.
Crazy. Wild.
So yeah, like cancer prevention, colon cancer, lung cancer. We've been really focused on that lately, particularly because Black folks have been being diagnosed with cancer earlier. And so we're really trying to spread the message, share health information, services, resources around screening and treatment for Black folks around cancer. So that's one area that we've been really focused on.
Yeah, that sounds like a big one.
Yes.
Yeah, it is a big one. We've also been like going more global. So we're expanding a lot of our work in South Africa, events planned, just everything. We're really just trying to like have more of a footprint there and make those connections. And then we might be doing something in Jamaica as well. So yeah, like I'm happy like to be adding like another Black country to what we're doing. So there's just so many lessons that can be learned about community engagement as when you start going outside of the United States and seeing how people are surviving and just making it work, and all the activism that's happening in other Black spaces is so inspiring. And that's just obviously like building on the legacy that like we have like with all the Black liberation movements. I feel like there's a strong global piece of all of that that made all of us stronger. So we just want to be a part of that.
For sure.
Yeah, and then we also mental health, maternal and infant and child health in Black women, especially in Georgia, because we know that is a dire situation for Black women and our babies. Yeah, we just try to touch on everything because, unfortunately, everything, like any disease state, unfortunately impacts Black communities oftentimes the hardest.
Yeah.
And so we just
Even
really,
COVID.
yeah, COVID, I mean, everything, unfortunately. So just really trying to reach out to as many areas as we can, also focusing on social determinants of health. So those are the conditions in which you live, learn, work, and play.
Yes.
That impacts your health. So you're talking about things like your living environment, what type of foods you have access to, education status, like if you're living in poverty, or your socioeconomic status. So how all of that intertwines and plays role in your health outcomes, which again is all kind of underpinned by racism. So we just out here trying to educate, engage, and empower the community.
And y'all are doing it. You are doing it. Matt, what you got? What you passionate about?
I think everything that the team has named is really the direction that we're going. But I'd also add, we want to make sure that current health professionals and the future health professionals are also equipped with the same knowledge, so that we're not just recreating the same problems.
Yes.
And so we've really been focused on how do we produce better trainings, better education materials to make sure that folks who are going out in the community who want to do this work are doing it well, and that they're actually not doing more harm than good.
Absolutely.
So whether it's cancer, whether it's child health or maternal health, making sure that they're approaching it with the right context.
Yeah, absolutely. All very important issues. And I really can't thank y'all enough for like the work that y'all do, and the fact that y'all are a nonprofit and that you focus on our communities, because it is necessary work. So thank y'all so much. What do y'all have planned for this year? What are you looking forward to?
Man, we got a lot of stuff planned this year.
I'm excited. Expanding your global reach already.
Yes. So we have, like Paula mentioned, we have some great programming and stuff coming up in South Africa. So we're doing an awesome event in South Africa called the Link Up. So we initially did that first event last year in Los Angeles, but it's like, think about like a lit block party meets like a health fair. So
yeah, when is this?
This is going to be April 29th.
Dang, I want to go.
You should
I'm
come.
gonna be in Mexico.
I
know, right?
We got some other
else I
stuff
would.
percolating in South Africa that I have you in mind for. So don't worry, we got you.
Y'all know that's one of my favorite. Me and Paula gotta come back. We just gonna talk about South Africa, but okay.
So
Expanding.
we're really looking forward to that. We have some lung cancer health events coming up that we'll be doing in Georgia. So we have some that we're doing in Atlanta and Augusta. We'll also be doing some programming around HIV, because National HIV Testing Day is coming up. So we'll probably definitely be doing an initiative around that. Again, just trying to get tests into people's hands that need them. Juneteenth is around the corner. Might have a couple fundraisers, because we need them dollars to keep doing this amazing work.
Absolutely.
We actually just received a grant to do more lung cancer programming that we'll be doing in Houston, Texas, which is in this area called a cancer belt that has higher rates of cancer because of just different environmental factors. And of course, these are in Black and Brown communities.
Of course they are.
So yeah, just really excited. We got a lot of dope stuff in the pipes now. Like, we all full time, so we can finally like put all of our efforts into Black health. We no longer have to slave for
I
the
love
man.
to hear that. That's my favorite thing to hear, is that you've done enough with your passion that you can commit to it full time. That is like the best thing. So
Yes.
I am so excited to hear that. Let's see. What are your short term goals with Black Health, which we probably heard some, and then what are your longer term goals?
Yeah, so I think Mercy or Matthew brought up that we're really interested in engaging more in those social determinants of health. And so those like big picture macro level factors that impact our health outcomes across different disease states versus like honing in on just one disease state. So we're trying to get more in our policy bag, get more
Okay.
engaged in policy advocacy, because we know how important health and social policies are to our health. And that's where a lot of the decisions are being made at. We're trying to get more in our research bag as well.
Yeah, okay.
So we've been engaged in some really great partnerships with academic research centers across the country. And we're trying to really build that to make sure that the research that's being produced about Black life and Black health is really nuanced and culturally reflective and really meeting the needs of our community. So there's areas we're really working on. We're also really trying to engage more with intersectionality.
Yeah.
And so we know that Black folks aren't a monolith, that we hold multiple intersecting oppressed and privileged positions in society, and we really want to be more we want to respond more to those nuances more. So when it comes to Black rural folks, we know the experiences of folks living in rural areas in terms of healthcare access are even worse. When you think about Black, queer, and trans folks, we know that those experiences, again in the South, in these conservative states, are kind of getting hit from multiple angles.
For sure.
And we're always focusing on Black women, of course. So yeah, really trying to get those intersecting like Black and identities.
Yeah.
Matthew, long term? Matthew's the big idea guy. So
Okay.
I know he
I
always
want to do
has.
everything.
Wants to take over the world.
I think our organization is well positioned. I see us like replacing public health departments, being like the Black public health department.
Oh, I like that.
I think we can do it well and do it better. And with proper funding and resourcing, I think we have the expertise, the context, and the network to make it happen. I think in the short term, I'm really looking forward to, I think Khadijah's like half-time, getting Khadijah to full-time, so that she can come on but she has to get that dissertation out of the way. And then, also adding, some additional folks to our staff. I think we've taken the organization to a really good place, but I think we can continue to grow, and bringing in people who have some supplemental skills will really help us. And so thinking over the next, even this, as early as this year, adding some new folks to the team will really make us stronger.
Yeah, I think so too. I'm excited. Yes. I can't wait to see what y'all do. So what are you most proud of, and what is your hope for our collective futures?
I know. Like proud of as an organization, or just like proud of
I would say as an organization.
Well, I would say just our growth in general. Like when we started this organization, and we literally just started selling sweatshirts that said Black Health Matters.
Fundraising.
Yeah, just like
fundraising. Yep.
All right, y'all. So, and then it became like, okay, so like now what? And we really just sat in a room and just pulled out some flip chart paper and just started writing stuff down. And we were like, we have no idea how we gonna do this, if people are gonna even like this. Like, we don't know where this is gonna go, but we just gonna do it. And we've been very consistent, meeting every week despite people moving. Like Matthew and Khadijah were in DC for a while. Paula's been in South Africa for like 3 years. And like, life always takes you different places, but we've always remained consistent with doing this work. Like regardless of what was going on, it's like, all right, y'all, we meeting. So, like we gonna move these meetings to online. Like, we were doing virtual meetings before that was a thing.
Mm-hmm.
Like, so, just us, I'm just really proud of how we've stayed consistent and just kept our heads down and done the work and are now really starting to see the fruits of our labor.
That's dope.
And I think on that, like what really motivates me to stay consistent and do the work is the response that we get from people when they encounter our organization and our services. Like people are so just like into it, and like it's kind of always been like that. Like even when we were just selling the shirts, right? People were like, "Oh, these are so cool! Like, what's this about? What y'all doing? Y'all group? Can I join?" And that was just off of like what the shirt said, Black Health Matters. But then now that we're out passing out tests, like providing all types of resources, holding events, and just seeing like the energy that people have, and like that it's exciting, and that Black people want this. They've been asking for it, and we are just one organization responding to that need, and people are really really welcoming us and excited. That gives me a lot of hope for our collective futures, because it just shows that like we are here and all hands on deck, and people are on board, and they want to support it, and they want it to grow so that we can all like realize like good health for our communities.
I love that.
I'm really proud of the unique.
That's what you are. Don't get me started.
Unique approach that we have taken with our public health work. I think we bring in a lot of fun and coolness and accessibility to our work that a lot of more conventional public health programming and nonprofits and public health departments, all that stuff, don't necessarily bring. I'm proud that like from the get-go, we've been talking about racism, because no shade, but a lot of people didn't start talking about it until 2020.
Now that's real. Those are the facts, okay?
So I'm proud we've been consistent and very firm in that stance of calling out racism even when it wasn't popular. And I'm also proud that we've really expanded from providing like education and information to providing like actual like tangible services and resources to our communities. And yeah, just as we've grown, like we've been able to have like a fun to get people screened and really give out different like resources. And I'm really proud that we've been able to do that.
Yeah, that's tangible solutions.
We've been ahead of the curve.
Yeah.
They just
Set
bid,
the curve.
They just bid the wave.
Facts.
I'm really proud of just like us. I think it's hard for people to go into business together and like remain friends.
It's true.
And I think our work is really motivated out of our love for Black people. But I think that love also transmits between the four of us. And so I think that really holds us together and holds us accountable to our communities. And so that makes me proud and hopeful because I believe that we can certainly change the world.
Absolutely. And any collective hopes for the future of Black folks?
Man, like we talking big dreams.
Yeah,
reparations.
You got to be thinking big.
Always
big.
Reparations now.
Yes.
I mean, our vision is a world where racism and other intersecting forms of oppression don't impact the health of Black folks across the diaspora. So that's always like our northern star and like where we're trying to go towards. Again, like that, we're really trying to bring in that intersecting piece too. So all Black people, we definitely want to make sure it's not just some of us. It has to be all of us.
Not just some of us.
Yeah.
Absolutely.
All of us, yeah, I think that's a good one. Like really just like reaching our vision. Like this has been the vision since day one, and like just getting there. Because, you shouldn't have worse health outcomes just because you're Black.
For sure.
Like being Black shouldn't be like a detriment to your health. Because being Black is lit. It's a little dangerous sometimes, but
and it shouldn't be that.
It should not be that. Exactly. Like I want us to just be able to live and be free and just be authentically ourselves and like our best selves.
Yeah.
Liberation.
Yes.
Yeah.
I feel that. Well, thank you, Black Health. We know that the people can find you at blackhealth.com, BLKHLTH. It's Black Health without the vowels, simple enough. And where else can y'all be found?
Instagram, Facebook, Twitter, LinkedIn,
podcast.
TikTok.
The Black Health Podcast, produced by
Spotify.
Philosophy Media
Yeah.
Group.
Yes. On what, Spotify podcast, Apple Podcast.
Yeah.
What's it
Everywhere
called? All
podcasts
that.
are found.
Exactly. On
And
the
y'all make
web.
sure that y'all tap into blackhealth.com, look at the resources, follow them on Instagram so that you can be tuned into what they have going on in Atlanta and globally. And as always, make sure you subscribe to the Modern Philosophy Podcast, subscribe to the Black Health Podcast. You can check us out at anchor.fm/modern philosophy. That's modern with an E on the end. Or you can check out philosophymediagroup.com. My name is Ashlee Haze, and together we are learning better, doing better, and being better. And we usually do a song of the week. So I am going to let y'all. I know I just put you on the spot. I know it wasn't in the list, but I actually want to hear like what comes into your head as your song of the week, what you've been listening to.
Song of the week. What did I wake up listening to? Okay. My song of the week has been Big Crit's Temptation.
Okay. All right, who next?
About to play it.
I have to look at my Spotify.
We can't play it. We don't have
Crit.
Well, I've been listening to Sun, Moon, and Herbs, which is by Venna and Jack James. I've really been.
I like Jack James.
I do too. A lot of work with Alex Isley I've been seeing. So I've been vibing out to the Spotify low key station. So
I'm gonna have to check that out because I like Alex Isley too.
Yeah.
Her voice is so magical.
Bumping a lot of Spitter lately.
Okay.
So Real Family by Currency.
Okay.
Yeah.
Only real ones now. I love Currency, the hot spitter. Let me say, you can't tell me
nothing.
nothing.
Had a great time at a Currency concert once.
I imagine it's a good time. What you been listening to?
Beyonce.
Of
but
course.
Actually, I was re-listening to "See at the Table" yesterday, and that's really like it's a perfect album. It is. So yeah, just going back and forth, seeing the Knowles sisters.
I feel that's never bad ever. And Paula, what you bumping?
I've been listening to that song "Greatness" by Quavo.
Okay.
Because I'm still mourning Takeoff, and that line that he has about "Take gone, we gone, Migos can't come back" or something like that. It just really gets to me every time. But I do actually like the song as well. But I think it's a powerful song, and it's like, damn. So sorry to end off on a sad note. But but I actually do fuck with the song too. It bumped. But yeah.
Yeah, that was a moment, you know. I was mad at the world for a very long time.
I was like, what do you mean?
Like this
the most unproblematic person, like
a person who's not bothering nobody. So.
They took my cousin.
Really, it really does feel like that, especially because like I spent high school in Gwinnett County, so it's like North Side, and they were
Stupid
coming
North
out of the
Side.
North. Which
said stupid North Side.
No, not stupid North Side.
No, that was the name of the activities that they partook in up there.
The activities.
The collective.
That makes sense. Yeah. So, well, thank y'all so much. I really appreciate y'all for being here. Thank
you for
y'all
having us.
for tuning in to the Modern Philosophy Podcast, and we will see y'all next time.
Bye. Baby.